Assalamualaikum, my dear students. This is a lecture for lecture 8. So in lecture 8, I'm going to talk on regulatory and also professional oversight in medical laboratory, especially in Malaysia. People working in clinical labs often believe their work is of the highest quality and adhere to what they believe is the highest standard. But the problem is, which is their personal opinion. So these words represent the needs for legislation and also accreditation. So we need another person opinion when to say whether our lab do have the highest quality and the highest standard. So the opinion will be coming from third party, from accreditation agencies, or from the government agencies. The situation now in Malaysia, if we want to open a lab, first we need to have a license to operate. This license to operate is based on Laws of Malaysia, Act 674, Pathology Laboratory Act 2007. This Act 674 is to ensure medical labs meet required standards of practice. And the required standard of practice are similar to MS-ISO 15189. Second, certificate on competence. This is optional, but it's great for a lab to have this certification. It shows that they are confirming and they are recognized to be competent by Standards Malaysia, Department of Standards Malaysia. So if you go out, for example, if you visit hospital, you saw that the labs is accredited by Department of Standards Malaysia. That means the lab is recognized to be competent in producing a high quality result. But this is still optional in Malaysia. And third, in the near future, for a scientist or MLTs to work in the lab, they need to be registered, which is before the registration, the scientists and MLTs need to comply with the certain requirements, and then they can practice. This, according to Laws of Malaysia, Act 774, Allied Health Professions Act 2016. This Act 774 is to prevent malpractice among allied health personnel, including clinical scientists and MLTs. So let's have a look between accreditation and legislation. So first we look on the definition itself between accreditation and legislation. Accreditation is a procedure by which an authoritative body give formal recognition. I mean, they are recognized. It's not a law. It's not mandatory for them to have this accreditation, but once they have it, they are recognized that a body or person, for example, in our station, a lab, is competent to carry out specific tasks. Example of authoritative body that able to give the recognition is Department of Standards Malaysia, which they would give Malaysia Standard ISO 15189 2014 to the competent lab. That means the lab, medical lab, that are able to produce a very high quality results. For legislation, the definition is control of actual laboratory practices are made through laws and regulation. The authoritative body is the Laws of Malaysia in the form of Pathology Laboratory Act 2007 and also the allied health professions. Before we go, what is accreditation? First, we have a look on the situation in Malaysia versus other countries, such for example, France, where healthcare financing, insurance, is well established. For example, for insurance reimbursement, that means if you are admitted to hospital and you have a medical card, of course you want to claim from the lab fees from your insurance company. For these countries, such as France, this claim will only be able to be made to accredited labs. As for Malaysia, claim can be made in any hospital because it is still not mandatory to be accredited. Second, if the lab is already accredited but they fail to comply with the accreditation requirements, that means the authoritative bodies has withdraw the certificate because of non-compliance. So in Malaysia, if this situation happen, the lab can remains to be operative. I mean, it can still open even though the accreditation is no more. As for these countries, government can close down the existing labs because they believe if they fail to the accreditation, they will produce a substandard, they mean a low standard lab results. Let's have a look on what is actually accreditation. Accreditation in Malaysia, we have ISO 15189, medical laboratories requirement for quality and competence. This ISO 15189 is a combination of ISO 9001 and also ISO 17025. Who is the accreditation organization in Malaysia? That means who can give this accreditation, who can give the certificate saying that the lab is have the ability to produce quality results. For Malaysia, we have the accreditation organization is the Department of Standards Malaysia. All duties and functions are governed by the Standards of Malaysia Act 1996 under the National Laboratory Accreditation Scheme of Malaysia. Why labs needs to be accredited? Accreditation is the recognition by other people, third party, that the results produced by us, by our lab, are reliable, and if they are reliable, we will be given a certificate of the competence. This means that we can show that our lab has an improved quality management, which resulted in greater control of laboratory process, and our lab also comply with international standards since ISO 15189 is an international standard being used worldwide. It means our result is supposed to be accepted within and beyond borders of Malaysia. This also demonstrates our commitment to quality, which lead to customer confidence on accredited labs. And in the end, finally, we have a brand value because why don't you try to compare a hospital with accredited lab versus non-accredited lab? Which one would you choose? Of course, for me, I will choose lab that have the accreditation. because I believe by having accreditation, they can produce a quality results, which is very important. This lead to customer satisfaction and also rationalization of services. Advantages of accreditation to the labs. First, to the lab managers, it became a tool for management by quality. So the manager can control the quality of the labs based on the requirements of the accreditation agencies. The first advantages is saving of time and money, reduction or elimination of retesting. So because we believe all the results being produced have the highest quality. Better control of laboratory operations, increase our confidence in test results and personnel performing work. Customer can identify accredited labs because accredited labs will be listed in a special list of accredited hospitals and labs. Greater access in domestic and international market, which will improve medical tourism and also Medicare with international standards. Eventually leads to customer confidence and satisfaction. And finally, hopefully can increase the business. Talking about accreditation, before the lab can have the certification, there are 10 basic technical requirements for ISO 15189. I mean, these 10 technical requirements need to be in the highest quality of state. First, on the personnel working in the lab. This by having a well-written organizational structure, job description, qualification, CMAs and etc. Second, accommodation and environmental conditions need to be suitable, sufficient, which means all the necessary requirements to operate a lab need to be there. Electricity, waste management need to be some distance from the public, and also safe. Safe mean the lab need to be comply with all the necessary precaution for all the potential hazards for medical laboratory. Third, laboratory equipment, reagents and consumable. All the things listed here need to fit their purposes and need to have a highest quality specification. Fourth, pre-examination processes in the form of info for users, patients, request form, specimen collection, storage and transportation. Fifth, examination processes, test methods meets the needs, established methods by using an established methods, and all the methods has been verified or validated before being used. 6. By ensuring all results is having the quality needed by having a plans for internal QC and also external QC. 7. Post-examination process, the process of reviewing of results before being released to the patients or doctors. And also we need to have a plan of for sample storage. I mean storage of sample that have been processed earlier. 8. Reporting of results. The result needs to be accurate, clear, and all the identification of persons involved. For example, persons that were performing the test, persons who double check it, validate it, persons who authorize the results need to be able to be traced easily. 9. Release of results. We need to have a proper documented procedures on how and all the necessary precaution in releasing the results. This is very important. For example, to keep the confidentiality of the results. And 10. Laboratory information management. Also, in keeping the confidentiality of the results and the patient data. Authorization, that means who can perform the test, who can release the results, and responsibilities. Among the basic process requirements for accreditation include creating a policy document. So we have already talked in our previous lectures. There are two types of manuals, policy and also SOPs. So among requirements for being accredited is we need to have a proper, well-written policies, organization structure, and job description, etc. Second, we need to appoint a quality manager. Quality manager function to lead in the establishment of the quality management system and also to monitor process and continual improvement of the quality. We also need to appoint a technical manager which is responsible in managing the technical workload distribution among existing staff. All the process need to be properly documented and they need to meet the required standards of the ISO. And also the needs for internal audits. The internal auditor must be independent of the area being audited. So we will continue on the sensor in the next lecture.